Hi students, today we'll discuss about threatened abortion. Last class I told about the causes of abortion, so continuation of it. So here we'll discuss each. I have explained about the types of abortion. Okay, so in that first one, threatened abortion. Threatened abortion, I already told you what it is. So I'll again tell you the definition. It is a clinical entity where the process of abortion has started but has not progressed to a state from which recovery is impossible. Okay, so it is a clinical entity where the process of abortion has started but has not progressed to a state from which recovery is impossible. So that means there is recovery is possible. There is a chance for the continuation of pregnancy. That is threatened abortion. Okay, recovery is not impossible. That means it is possible. Next, clinical features. You can see the patient having symptoms suggestive of pregnancy and complaints of bleeding per vaginum. So bleeding, how it is, the characteristics of bleeding, you see the bleeding is usually slight and bright red in color. On rare occasion the bleeding may be brisk, sharp, especially in last second trimester, suggestive of low implantation of placenta. The bleeding usually stops spontaneously. So usually this threatened abortion, you can see in this case. So how it is it is light and bright red in color, and rare occasion you can see it is brisk and sharp, especially in the last trimester, late second trimester. Then suggestive of, so that will suggest the low implantation of placenta. So I have told you low implantation is the placenta has been located at the lower segment of the uterus. So what you call it as placenta previa. We have studied about the degrees of placenta previa also. Such cases you can see this usually, and then the bleeding usually stops spontaneously. So it bleeds and it stops by itself. Okay, that's about the threatened abortion. Next, you can see second clinical feature is pain. Okay, so second clinical feature is pain. So how about the characteristics of pain? Bleeding is usually painless, but there may be mild backache or dull pain in the lower abdomen. Pain appears usually following hemorrhage. So bleeding is usually painless, but there may be mild backache or dull pain in the lower abdomen, and also you can see pain appears usually following hemorrhage. Next, you can see pelvic examination. So pelvic examination should be gentle as possible should be done, and then in that what you are doing is speculum examination. Using speculum you examine. So how what it reveals in the pelvic examination, bleeding, if any escapes through the external os, you can see that it is bleeding is out through the external os, and any local lesion in the cervix may coexist. Sometimes you can reveal it through that speculum examination. Then digital examination, you can reveal that the external os is closed and the uterine size correspond to the period of amenorrhea. That means it is towards the gestational week period of amenorrhea, it is normal in size, and the uterus and cervix feel soft, and pelvic examination is avoided when ultrasound is available. Okay, so once the ultrasound is there, it's no need to go for pelvic examination. So we don't want to unnecessarily do an examination and to end up with the inevitable abortion where there is a continuation of pregnancy is not possible. So as much as possible, pelvic examination will avoid. If ultrasound is there, then that is the best method. Okay, and then investigation. So investigation, you can see routine investigation. We have to go blood for hemoglobin, hematocrit, ABO-RH grouping. Then blood transfusion may be required if abortion becomes inevitable. So inevitable, I told you, it has progressed to an extent where the pregnancy cannot be continued. Okay, then anti-D gamma globulin has to be given in case of Rh negative woman, and then urine for immunological test of pregnancy is not helpful as the test remains positive for a variable period even after the fetal death. Okay.